So in this echo session under the capsule, I will talk about EPSS. It only consists of 4 slides, but it's a very useful information or a knowledge tidbits to know for intensivists who are doing echo to very quickly ascertain LV function, because as you would agree, most cardiologists would be very much fond of knowing the exact ejection fraction. And if intensivist has to do ejection fraction either by using Simpson or fractional shortening, so it would take time. And in intensive care, we want a very quick assessment of LV and have a number put to that LV. So for that, I think EPSS is the good modality for intensivists to put a number to the ejection fraction. So EPSS is simply E point septal separation. So that is what it is. So it's a very simple tool. So basically you put a cursor, you do a parasternal long axis and put a cursor at the distal end of the mitral valve cusps and then put an M mode. So when you put an M mode, you get a image like this, which is a mitral valve excursion. So then you would look at the distance of this mitral valve excursion to the LV wall. So that is what is quantified as E point septal separation. So figuratively, if you have to look, so this is how the excursion of the mitral valve leaflets take place. So as you see, this is the interventricular septum and there is an excursion of mitral valve against it. So you will have this anterior leaflet and posterior leaflet. So you have a E wave and A wave. So and you look at the distance between this and the interventricular septum. So you would get an image like this. So you measure, you put a caliper and measure the distance from here to interventricular septum and ascertain, get a number when you put a caliper, and those numbers will correlate to the ejection fraction of the patient. So the simple thing to remember is if your excursion of the mitral valve is very good, it is approximating to the interventricular septum, then your LV function is very good. If it is not approximating to the interventricular septum, then your LV is probably dilated and LV function is poor. That is the rough understanding of E point septal separation. So here, see here, you would see that mitral valve is approximating very well. So your LV function is very good. So here it is not approximating. So here there is severe LV dysfunction because 2.3 centimeters is very large. So 18 millimeter is our upper limit. I'll show you the values. So these are the values. So normal. So if your E point septal separation excursion is less than 5 millimeter, then your ejection fraction is more than 50%. So if your E point septal separation is more than 8 millimeter, so if you have this distance more than 8 to 18 millimeter, anywhere between 8 to 18 millimeter, then your ejection fraction is somewhere between 30 to 50%. So if your E point septal separation is more than 18 millimeters, so you have to remember only two values, 5 and 18. So less than 5 is normal, 5 to 18 is 30 to 50%, more than 18 is less than 30%. That's all. So this is a very useful tool for you to quickly determine and put a number to your LV function. So I think the audience intensive is, we're all evidence based. You may ask, is this validated? So let's look. I think E point septal separation is known to correlate well with ejection fraction, and it is even found it is a reliable index in patients with coronary artery disease with LV dysfunction. But this correlation tends to decline when there is a regional wall motion, and this applies even when you're doing conventional ejection fraction measurement by putting a cursor and doing in a conventional way in systole and diastole. Even there, when your cursor has missed the regional wall motion abnormality, it may overestimate LV function even otherwise. So same limitations do apply, and these are the two studies which showed reasonable correlation with ejection fraction. And this was one study which did suggest that EPSS did not correlate well with fractional shortening. So overall, for intensivists, my conclusion is it is a quick way of assessing the LV function and putting a number to it. And in our practice, we have seen it has a very good correlation with a complete sort of ejection fraction calculation. So thank you very much.